mucosa of the vermilion of the lip. And then, I'll grab a light here. You can use a light source. And here we have a very bright xenon light source here in the ENT clinic. And we can get Brittany to open up her mouth here. We can feel in here some minor salivary glands below the mucosa of the lip. We can see the alveolar mucosa here, and then the gingival mucosa underneath her teeth, the intradentate papillae. Similarly, up here, we can see the mucosa of her lip on the inside. We can see the attached gingiva. We can see the frenulum to which the upper lip attaches to the gingiva. Okay. I'll get Brittany now to open up her mouth a little bit. So we can see in the buccal mucosa at the level of the second upper molar is a bump there referred to as Stenson's duct papillae. That's where the parotid gland drains. Similarly, on the contralateral side, we can demonstrate the same duct at the tip of my tongue depressor there. You should also check the condition of the teeth, as an infected molar can be the source of a neck abscess. We then look inside the space between the lower teeth and the tongue, and get you to tilt your head down there, Brittany. We can see on each side here we can see the frenulum of the tongue here. We can see that there is these ridges here, which are the submandibular gland ducts on each side here, these white ridges coming across here, submandibular ducts, and they drain in a papilla. I'm going to swallow. Yep. Okay. They drain in a papilla on each side of the frenulum here, referred to as the Wharton's duct or submandibular gland duct on each side. This can be a common site of where stones can form in the submandibular gland. So here we've gone into Brittany's mouth here with the endoscope again. Here is her second molar, and besides her second molar, her upper second molar, we can see Stenson's duct right here, which drains into the parotid gland. We'll now get Brittany to lift up her tongue, and we can see right here the duct, Wharton's duct, for the submandibular gland, and on the side of the lingual raphe here, the frenulum, we can see Wharton's duct drains right there. Often stones can originate in this area here. These are the normal veins of the tongue. The next thing to examine is Brittany's tongue. So Brittany, get you open up her mouth. When you examine the tongue just in a resting position. Okay. Then ask the patient to stick their tongue out. Go to the right, Brittany, with your tongue. Okay. Then you can insinuate your tongue depressor there and check the lateral border of the tongue on the right hand side. Stick your tongue out to the left, Brittany. And again, we can check the lateral border of the tongue. These blue vessels here are normal. Those are just veins of the tongue. That's not an abnormality. Okay. If we also want to examine the tongue more carefully, we can actually ask the patient to stick their tongue out and grab it with a gauze. And you can actually then manipulate the tongue and move it around to examine for any lesions. The other important thing to do is that if you do identify a lesion in the tongue, it's important to palpate the tongue and feel the extent of the lesion. You can also palpate the base of the tongue as well. Be aware that this will cause the patient to gag. So the next thing to examine is the palate. The palate is divided into a hard palate region and anteriorly, and the soft palate region posteriorly. There's a junction right here between the hard and soft palate. The incisive papillae is right over here at the front between the two anterior incisors or midline incisors. And then we should look more posteriorly. In order to do that, we're going to need to use a tongue depressor. It's also important to note one more thing here. Here's a pterygomandibular raphe here. Okay. Now we'll go back more posteriorly here, and we'll take two tongue depressors. And this is an important skill. You need to rest the tongue depressors on the tongue and then sweep the tongue forward. And that gives you an excellent view of the posterior oropharynx. And we can see here the anterior tonsillar pillar, the posterior tonsillar pillar, the tonsil itself, the uvula right here in the midline. I'll just try to adjust that tongue depressor like that. Good. The uvula right there in the midline. Again, the posterior pillar, the anterior pillar, and the tonsil, and then the posterior oropharynx